Okay, so if you're having some neck pain and you feel that that neck pain is starting to go down your arm, right? And when I mean by down the arm is a lot of people will talk about how they start to feel pain that's getting to be like in this upper trap, into the shoulder, down even into the biceps, past the elbow, and sometimes even in the hand. And those symptoms would be things like actual pain, sometimes numbness, some sort of tingling. A lot of people just will call it sort of like a dead arm feeling, meaning that they can just tell there's something going on. Okay. This is something we treat quite a bit here at Mission Move. And one of the first things that we usually do with this is to get the person moving. Okay. And I've shot some videos about this before. We'll make sure the links are in the description. There's some things we do as far as nerve glides go, even thoracic or shoulder clock that tend to help this a lot. So if that's what you're experiencing, that is where I would start, because a lot of times people just start to get this because they're stuck in one position, often at a desk, um, and just the body doesn't like being in one position, and then their head's in a position where that it starts to put some pressure on the neck. Actually had a guy come in to see us recently, and he works from home, and he admitted to me that he likes to lean his chair all the way back and sit like this, okay? And so, if you're watching this, which I doubt you are, but you know who you are. And, but yeah, I mean, it's like his chin was almost all the way to his chest here, right? And, when you're sitting like this, it doesn't seem like your head's tilted forward. But if you were to sit up and you thought, man, my head's down like this, then it would make sense, right? As to why your neck would hurt. But that flexion of the neck like this is very similar to the pressure that your low back would get if you sat all the time. Okay. So we always start with getting the patient out of that posture, moving the arms, doing some nerve glides, doing some back exercise, getting some lifting up. Okay. But one of the things that often is needed, and we add to the treatment at some point, it's not always needed, is cervical traction. So maybe you've clicked on this video and you're interested in traction and just kind of want to know a little bit more about it. So cervical traction is basically using a device. And we'll talk about devices here in a second, but you're basically using a device to uh, what I would use is like a broad term of decompressing the spine, right? And what that does is when you pull on the head gently and for longer periods of time, what we think is occurring there is it's creating some space. Now, on some level, um, when we really research this about how much force it would take to actually cause some stretching of ligaments that go in between the vertebrae in your spine, it's not near enough force to do that. But when we have people use a cervical traction device, it tends to help and they tend to get less symptoms. So it works, right? How exactly it works, I think is probably up for some debate. But either way, it does just help to open things up a little bit, less irritation of the nerve, whether that's from pressure or something else, and people get less symptoms. The further your symptoms are down the hand, kind of the worse the problem is. And as it gets better, you want those symptoms to come up the arm. We call this centralization of symptoms. Okay. So that's a lot of times what will happen when we're treating people with this sort of dead arm type feeling. They're like, I'm not feeling it in my hand as much, or I'm not feeling it in my forearm or elbow. It's starting to come this way and it's feeling a lot better, right? So how that's kind of how cervical traction works. Let me just show you quickly this machine. So what we do is we have two of these machines here. This is a medical grade device by this company called Saunders, um, and this is a little bit older model. We actually have an updated model that one of our patients is borrowing right now. We just let people borrow it because we found that a lot of the devices that you buy online aren't that good. And so, although you can buy this one online, and we'll post a link to that. That being said, you can buy this one online. It's not the cheapest one by any means, but it works really, really well and is well worth it as opposed to buying a bunch of cheap one junk stuff that doesn't work. So let me just show you a little bit about how it works, this particular model. And so what you're going to do is you're going to lay down. Okay. You're going to put your head right here with these pads that sort of rotate at the base of your skull. And then you're going to um, use these knobs to tighten it up right there at the base of the head. Then there's this little strap here. You can adjust this ahead of time. You just put that on there to hold the head in place. Okay. And then this little air pump, which pumps both directions. There's a little knob here, and you put it to hold not the hold position, but the pump position. And then you go ahead and pump, and you'll see that it's pulling up on my head. And you actually want to give it. It's gonna pull pretty hard. And once you get it up to, usually I try to get people up to about 20 pounds on this here gauge. I think that's what it is. I don't have my glasses on. So we'll see 20, whatever 20 is. And then you move it to the hold position. And then you want to stay here about 5 minutes. And you do a protocol of about 5 minutes on, a minute off for about 25 to 30 minutes is usually what it takes. Now, this is kind of hard for people to do because you really can't do a whole lot unless you have like a TV on your ceiling, which would be kind of weird. But yeah, you kind of just have to chill here and let it pool. Some people don't tolerate this at all. Some people love it. That's why some people actually go ahead and purchase and buy one of these things. They're like, man, that helps so much. I tend to have neck pain every now and then. I can just spend 1 or 2 sessions with this and it clears it right up. So that's basically how it works. And then you turn the little knob here and you turn it to release. And then as you can see, it lets the air out and decreases the pressure. And then you can sit back up. Okay. So if you're interested in cervical traction, that's kind of how it works. That's exactly how this works, using that air pump to pull on your head. Takes a little bit to get used to at first. Like I said, some people don't tolerate it, but a lot of people love it. Um, and I just would, like I said, I'll put a link to this. I do recommend this machine. I don't know what the current price is of it right now, but it is a lot more expensive than some other machines out there. But it's, to me, it's well worth the price, and we've had several people purchase them. Now, if you're someone that's local to us and you're experiencing some cervical issues, some neck pain that involves symptoms down the arm, we'd love to be able to reach out, for you to reach out, and we'd love to be able to help you. And so you can always on our website book a phone call if you're local, and we'll be able to talk to you through it and just see exactly what's going on and how we'd be able to help. So anyway, if you're having neck pain, you're interested in cervical traction, hopefully you learned something from this video. If you have any questions or comments, you can do that in the comments below, and we will talk to you again soon.